It was supposed to be routine. A patient recovering in the hospital, a nurse following doctor's orders, medication administered like thousands of times before. But on this day, something went terribly wrong. Within hours, that patient was dead, and all eyes turned to the nurse. Was this a tragic human error in a high-pressure environment? Or was it something far more serious? Reckless homicide? This is the story of the nurse's dose. It was a crisp morning inside St. Mary's Hospital, a mid-sized medical center in Nashville, Tennessee. The patient, a 75-year-old grandmother named Evelyn, had been admitted for a mild infection. Doctors were optimistic. She was stable, alert, and even joked with her family the night before. She was expected to be discharged in a few days. Enter Rachel, a 34-year-old nurse with nearly a decade of experience. By all accounts, she was competent, hardworking, and beloved by patients. That morning, Rachel prepared Evelyn's medication. She logged into the hospital's electronic system, typed in the drug name, and walked briskly down the hallway, syringe in hand. But what happened next is at the heart of this tragedy. Instead of administering a mild sedative as prescribed, Rachel gave Evelyn a powerful drug meant only for emergency use. A medication that, in the wrong dose, could stop breathing altogether. Within minutes, Evelyn's condition deteriorated. Monitors beeped, alarms sounded, and staff rushed in. Despite their best efforts, Evelyn went into cardiac arrest. She never recovered. Shock rippled through the hospital. Evelyn's family demanded answers. How could something so routine go so fatally wrong? Investigators quickly discovered the mistake. Rachel had selected the wrong medication from the automated dispensing cabinet. Some said the system's design made it confusing. Others argued Rachel should have double-checked the vial. Soon, the case leapt beyond hospital walls and into the public eye. Prosecutors charged Rachel with reckless homicide and criminally negligent homicide. For the first time in years, a medical error wasn't just treated as malpractice or grounds for a lawsuit. It was treated as a crime. The case divided not just the courtroom, but the entire medical community. Nurses and doctors across the country rallied in Rachel's defense, warning that if honest mistakes could land healthcare workers in prison, many would fear doing their jobs. "We're human," one nurse said at a rally. "We work long hours under impossible pressure. One mistake should not destroy a life and a career." But Evelyn's family saw it differently. To them, Rachel's actions weren't just a mistake, they were reckless. "My mother trusted that hospital," Evelyn's daughter told reporters. "She trusted that nurse, and one careless moment took her from us forever." The trial was emotional. Prosecutors painted Rachel as negligent, arguing she bypassed safety checks and ignored protocols. They said her actions went beyond mere human error. They were criminal. The defense countered that hospitals run on broken systems, understaffed shifts, and endless fatigue. Rachel, they argued, was being scapegoated for institutional failures. The jury deliberated for days. Was Rachel guilty of murder? Or had the system failed both nurse and patient? The case sparked national debate. Should healthcare workers face prison for mistakes made under stress? Or does accountability demand consequences when lives are lost? And perhaps the hardest question of all, when we put our trust in those who care for us, how much responsibility rests on one individual's shoulders, and how much on the system around them? For more chilling true crime cases, subscribe to our channel. Guilty or Not.